Hello, I'm Dr. Robert Lelouch, a board-certified OB/GYN physician with over 30 years of clinical experience. And today we're going to talk about type 1 diabetes and pregnancy. Really very different than type 2 diabetes or gestational diabetes of pregnancy. So those other two diabetes are where a woman has insulin resistance, whereas type 1 diabetes, the pancreas isn't making enough insulin. And it's very important to have good control of diabetes to have a successful pregnancy. So if you take home any message from this video and you are a type 1 diabetic and you're wanting to get pregnant, you need to see your physician and let them know that you're interested in getting pregnant to plan on it to have a much more successful outcome. If your diabetes is way out of control, it will interfere with getting pregnant. But if it's just a little out of control, it can lead to miscarriage or birth defects. So if you're diabetic, type 1, you should be familiar with something called the hemoglobin A1C, and we know that birth defects start happening and miscarriage rate goes up with a hemoglobin A1C of 8 or higher. I have seen pregnancies in women as high as 13 or higher, but those always turned out very poorly. So get your blood sugar under good control, get on the right medicines that are okay for pregnancy, and then you will have to have a lot of effort, more close control over your insulin, your blood sugar, your diet, your exercise, in order to regulate your blood sugar, because you'll be more prone to highs and lows. Low blood sugar is more of a problem for you as a type 1 diabetic than someone who's type 2 or who has gestational diabetes. So it's more effort. You will need some extra care, extra attention. You will need, I highly recommend, a high-risk obstetrician to be involved with your care, and to have an endocrinologist or the obstetrician or your family physician be aggressively managing your blood sugar levels with insulin. You'll need extra monitoring at the end called antenatal testing with non-stress tests, fetal heart rate tracing, ultrasounds to see the fluid, perhaps biophysical exams, regular visits at the end, often delivery sooner. You have a higher risk of high blood pressure of pregnancy, of complications. You need to make sure any kidney problems are taken care of. If you don't manage yourself and take care of this, you can also do damage to your kidneys and to your long-term health by having recurrent pregnancies with loss because of poor diabetic control. So the good news is, with appropriate management, you can have successful pregnancies. But if you don't focus in, you don't take good care of yourself and of the diabetes and manage it well, then pregnancies can be very problematic, can accelerate the decline of your health in a very big way. So take-home message again, don't forget, it's available to you as an option, but you need to have good care and early care to have a good outcome. So I hope you found this information of use. Please leave your comments. Thank you.